Good morning, everybody. We're just waiting for the numbers to stabilize a bit, number of attendees, and we will start the webinar in a few minutes or less even. All right, thank you. Thank you, Catherine. I think we can start. We can start now. Yeah, thank you. Welcome, everybody. Good morning. I'm Susanna Hlaskova, a portfolio manager in healthcare technologies, and I'm joined here by Catherine Freeman, senior portfolio manager in healthcare technologies. We will deliver the presentation for you and then answer some questions. And we're also joined by Kate Redding, a portfolio manager in healthcare technologies team, who will be helping us to solve some questions. We're also joined by Philippa Hemmings, who's the head of the theme of healthcare technologies, and she might help us with some tricky questions if some comes through. So this is a webinar for the Health Technologies Connectivity Awards funding opportunity. We will talk you through the opportunity first, and then we will have you will have chance to ask questions. You're obviously welcome to submit the questions throughout the whole presentation in the question and answer tool on your webinar. And we are hoping or expecting to finish this webinar by 11:30. But we will see how many questions we will get throughout. So regarding the agenda, I will start with the background and context of the opportunity. And then together with Catherine, we will talk you through the funding opportunity summary. And after that, we will answer the questions. We will also try probably to answer some of your questions in writing or in the question and answer tool, but we will see how we will go how we will go through that. So regarding the background and context, we have founded the opportunity on the EPSRC Health Technology Strategy, which was released in 2023. This strategy is outlining three main challenges. And I would particularly want to highlight the challenge of improving population health and prevention, which is a new or fairly new challenge for us. The other two is transforming early prediction and diagnosis and discovering and accelerating the development of new interventions. And besides all the three challenges, we have set out 6 enablers, which we would like to see addressed throughout the opportunities and throughout the projects. For the Health Technologies Connectivity Awards, we are particularly setting out to address the supporting knowledge and skills in health technologies, but we obviously expect to see other enablers to be addressed through your projects. As the Health Technologies Connectivity Awards must comprise a component of research, we would like to make sure that all the research is aligned with the health technology strategy and helps to deliver against the strategy. So all the projects will need to be in the remit of the health technologies theme of EPSRC and be aligned with the strategy. Thank you. So regarding the funding opportunity outline, I will first start with the aim and scope, and then we will talk a bit about what we mean by home and host organizations, what are the expected outcomes, what is the eligibility, what funding we have available, and finally, what's the assessment process and what are the assessment criteria, and what is the expected timeline for the panels and getting outcomes, and finally, where you can get any additional help. It might be in slightly different order, so we will see. So principal aim of the opportunity is to provide researchers with an opportunity to spend time in different research or user environment. And with that, we would like the researchers to better understand unmet health needs, but also how the engineering and physical sciences research particularly can contribute to developing new health technologies, approaches, and solutions, and as well how this could be potentially translated. This is a pilot scheme. So as you might have recognized, some of the components are similar to some of the funding opportunities you have seen before, which were called discipline hopping, but we have appreciated that some of the components didn't work fully. So we changed a few bits. So the scheme is opened to teams as well as individuals to apply. So you can develop collaboration as a team, and you can upskill your team, the whole team. And the component of the research is quite important in this opportunity. And must be mentioned. As a researcher, you can come from the EPSRC core research fields, for example, and then spend your time in some other relevant discipline or user fields or both. But we also welcome researchers coming outside of the core EPSRC disciplines to kind of move into the EPSRC core disciplines. Thank you. So what you can actually do with this award, we are expecting to receive some creative proposals. So these are just few examples of what you could use this award for. This award could be to use for opening a new cross-disciplinary research area or areas. You could answer a specific cross-disciplinary question if you already have some in mind. And obviously, we would like you to see develop new collaborations or strengthening your already existing collaborations, or both. And you can also learn, obviously, new techniques, tools, and or methods, and that there are not many limits to what you can do. And the expected outcomes. So I think this is also not full list of what outcomes can come out of this funding opportunity, but we would like to see better identification of the healthcare challenges and clinical workflows where the engineering and physical sciences has the potential to lead to novel solutions. We would like to also understand the drivers for the challenges, and we would like to broaden the awareness of the current state of the art in other scientific disciplines and how they can work together to deploy the solutions, and understand the social science as well and design factors to influence the adoption and use of the healthcare technologies, which we all know is quite challenging. And last but not least, obviously strengthen or build new collaborations and just increase the networks. So now to the nitty-gritty of the eligibility. As I've already mentioned before, this scheme is open for teams as well as individuals to apply. And the standard EPSRC eligibility rules apply for the individuals and teams. You can find it on the website. And I think the rules about international applicants is something to point out. We currently have EPSRC currently have an agreement with Norwegian Research Council. So Norwegian researchers can be named as co-leads on the proposals. But other than that, we cannot fund any other international applicants. So what do we mean with home and host organizations? It is slightly different to the standard grants. So by the home organization, we mean the organization which you are currently employed at. And the organization obviously needs to be eligible to receive EPSRC funding. The host organization is the organization which will provide you with the different research or user environment or both. This organization doesn't have to be eligible to receive EPSRC funding, but if it is, you can name your host in your core team, and the host can receive funding for salary, but also it is easier to deal with the cost for consumables and estates and so on. And we also allow engagement with multiple host organizations. So you, for example, can engage with a clinical practice, but also with public sector or industry, and so on. The duration of the funding is up to 36 months in total, and the working pattern can vary throughout the grant. So it really depends on what is the most suitable working pattern for you and your collaboration and your pilot project you're developing with the collaborator. And also, you can change the working pattern throughout the duration of the grant, which means, for example, you can work part-time for several months, then full-time for several months, and so on, and change that within the grant duration. It also can vary in between the team members as well. However, we would expect you to immerse yourself in the new environment, and we would like to see that described in the proposal. So you would have the sufficient training and development. The funding available is your project can be up to £500,000 of the full economic value, and EPSRC will fund 80% of this, which is 400,000. And we can fund the salary of the core team and the travel and subsistence while you are away from the home institution, training courses and development opportunities. Those would include even those which will lead to impact and to commercialization. And we can, as I mentioned before, fund the project colleagues which are based at the host institutions if the institution is eligible to receive EPSRC funding. And obviously consumables to carry out your research. And last but not least, spending on broadening the impact of the award and maximizing collaborative work between other disciplines. And now I will hand over to Catherine, who will talk you through the assessment process and assessment criteria. Thank you.
Thanks, Susanna. So I have a few slides on the process and then the criteria with which the applications will be assessed against. So the process will be an expert panel. So experts will review your application independently against the criteria which are listed in the funding opportunity. There will then be some feedback that will provide back to applicants, and you will have a chance to respond to these expert comments prior to the panel meeting. Then at the panel meeting, the applications will be ranked alongside other applications in priority order for funding. And we expect the expert panel to be held in December this year. So that's the process. And then following the expert panel, we will give some brief feedback, and we expect most of the feedback to be from the initial expert comments, but there may be some feedback from the expert panel that we will give back to you, and we will also provide that with the outcome of your application. So that is the process. Now I'll go through the assessment criteria. So this slide just highlights all of the criteria, and I'll go into them in a bit more detail. So just to quickly go through them here, the first criteria is around the vision, then the capability of the applicant or the applicants in the team to deliver the project, the career development aspects of the proposal, the home and host organisation support, the resources you're requesting to do your project, and then the ethical and responsible research and innovation considerations that you've made as part of the planning of the project. So I'll just go through each of those in turn, and you can find all of the details of these on the funding finder. So the first assessment criteria is around vision and approach. So this is where or you will be assessed against how your proposed work is of excellent quality and importance. It has the potential to advance current understanding or thinking or discovery within or beyond in the healthcare technologies field, how it's timely and how it impacts world-leading research, society, the economy, or the environment, and also who the potential direct or indirect beneficiaries or benefits might be as part of your work. Under the approach section, the assessors will be looking at seeing how you've designed your work so that it's effective, appropriate to achieve your objectives, how it's feasible, how you've identified risks and how they'll be managed, how you've used clear and transparent methodology, and how you've built upon, if applicable, sort of previous work that you're using to build on that to carry out this new work, how you'll maximise translation of outputs into outcomes and impacts, and how you and, if applicable, your team's research environment in terms of where you're actually going to be based will contribute to the success of your work. We're also looking for a couple of other things, so how you will demonstrate access to appropriate services, facilities, infrastructure or equipment that you need to deliver the proposed work, how the potential of the award to have a positive long-term impact on either yours or your team's research career. And then we're looking for a project plan, which will include like milestones and timelines as part of that to show how you'll deliver your work. The next criteria is around applicant and team capability to deliver. So this is looking for evidence of how you, and if relevant, if you have other team members on your application, how you have the right experience appropriate to career stage, deliver the work, how you've got the right balance of skills and expertise, thinking also about the collaborators, the host organisation, the organisation you'll be going to spend time in, and how you have the appropriate leadership and management skills to deliver the work, and your approach to developing others, and how you will contribute to developing a positive research environment and wider community as well. So the next criteria is around career development. So within your application, you'll have identified career development goals appropriate to this funding opportunity. You'll describe how the award will provide a feasible and appropriate trajectory for you or your team's personal development, and how you're going to achieve your stated career development goals. Again, thinking about career stage and field, as this will differ, and what mentoring arrangements you have proposed and how they're appropriate to you and your team as well. So the next criteria is around home and host organisation support. So the assessors will be looking for evidence about how the home and host will support you to achieve your award, who you've engaged with in your host organisation, how the research environment will contribute to the success of your work in terms of the suitability of the host and the relevance to the project, how the home organisation will ensure your time commitment to the award is protected, and what development and training opportunities will be provided at the host organisation, as well as at the home, if there are those as well. And what financial or practical support, such as access to appropriate services, facilities, infrastructure, and equipment, will be provided, and how that's strengthening your application. So just a couple more criteria to go through. So the next one is resources and cost justification. So assessors are looking to see how you've demonstrated that the resources you will need to do your work are comprehensive, appropriate, and justified, and that they represent the optimal use of resources to achieve the intended outcomes and maximize the outcomes and impacts of the work. Final criteria is around ethics and responsible research innovation. So this is where assessors will be looking that you have identified and evaluated any relevant ethical or responsible research innovation considerations and how you will manage those considerations. There's a further question if you are looking at collecting or using data, just identifying any legal, ethical concerns around collecting, releasing, storing, other consent, confidentiality, thinking about all of those ethical considerations as part of that, and also making sure that you've understood which formal information standards that your study will comply with if you are using data. Now I'll just go through quickly the timeline. So the call opened back in May. We've got the webinar now, and then the call will close at 4 p.m. on the 3rd of September. The expert review stage will take place between then and mid-November. And then you will have a chance between mid-November and end of November to provide a response to the feedback that you receive from the expert review stage. Then the panel will take place in December, and then we will be feeding back outcomes and any panel feedback as soon as possible after that. So probably between January and February. And final slide from me before we'll take some questions. So just a couple of, we're just given a couple of pointers of where other places where you can get help for your for writing your application. So there's information on the EPSRC website around the health technology strategy, and we can save the link there for you and when we circulate the slides. We will also upload a copy of this webinar recording, so please do feel free to circulate to colleagues who couldn't attend today and were interested about the opportunity. We will also upload an frequently asked questions document to the opportunity webpage as well. And if you have any other questions, you can reach Susanna and I via our team inbox, and the email address is there. So please do send us any questions through that. And now we will move on to the questions. So I will just stop sharing my screen, and then we can take some questions. So I will go through and have a look to see what questions we've got. Okay, so first question is, when would an applicant be expected to start the project after the communication of outcomes if they're successful? So I guess I can take that question. So we would expect you to start the project to within sort of 3 to 6 months of the start date that you have that you selected on your application. So you can choose your start date, and I think from that time, sorry, you have 3 months in which to start. Is there anything else to add, Susanna? I think that's right. They have
no,
three,
yeah, I think
3 months.
yeah, I think you can basically start as soon as you get the offer letter. Although I'm not sure if there are any changes with the new funding service on that, but I believe it's still the same.
Yeah, that makes sense. Next question was, is it possible to know roughly the number of awards available? Did you want to go for that?
Yeah, I can answer that. So we have currently a budget of 4 million in total, and each of the award can be up to 500,000. So it really depends on what size of the awards we will be receiving. So it can be anything from about 8 awards onwards.
Oh, thank you. And I can answer the next one because I think it was my my wording in the presentation that might have confused this. So somebody's asked, did you say there is external peer review before the panel or the panel only? So it's the panel. So it's the panel are doing the external peer review. So we will have the panel members will receive your applications. They will then provide feedback on those, and you will get that in advance of the panel meeting, but it will be the same people giving you that feedback as the people that will be sitting on the panel and assessing the proposals at the panel meeting. Hopefully that makes sense. Was there anything you think we could add, Susanna? Does that make sense?
Yeah, I think hopefully it is understandable. If not, please pop another question into into the Q&A. But you should receive a set of comments from the reviewers, who will then read your the same reviewers will read your PI response or project lead response. I think there is a question about overheads. I think it was one of those questions was already answered in the answered questions, but the standard rules for cost requests applies. So if you go to the EPSRC website, which outlines what costs you can ask for, this should be generally eligible. So yeah, the overheads for the home organizations are permissible. The next question is, in terms of the new skills the funding scheme will support the researchers to develop, how different the new skills should be comparing to the researcher's current discipline? For example, if a researcher has been working on biological signal processing, can they apply the funding to develop skills in the discipline of physiology or computational modeling, which is also in the field of engineering?
Yeah, so yeah, I would say that's absolutely fine, as long as you justify why you can't access those I guess that environment without applying for this funding award. So it would just that's absolutely fine. You don't need to be it doesn't need to be a field miles away from a discipline, as long as you are learning new skills. You can show how going into that new environment will help with those collaborations, and yeah, so I think that's absolutely fine, but as long as you can justify why you will be going to that particular area.
Yeah, I think it's to add on to that is we I forgot to kind of list examples of what host organizations could be, and another different department within your home organizations is also an eligible host for you. So you can stay active within your home organizations, but we would expect you to engage with new set of people or in your environment, which you wouldn't normally be exposed to in your current working.
Yeah. Let's see what the next question. I think there's a couple of questions on, is there a limit to the number of applications from each host institution? I think, and there's one, okay, so we haven't imposed a limit on the number of applications. So any number of applications can come from the same institution. That's absolutely fine.
So, yeah, on just to add onto that, we haven't limited any or haven't created any demand management on that. But obviously, if we are oversubscribed, then we reserve the right to probably tweak the assessment process slightly.
Yeah. We've got another question because I feel like I didn't answer it very well. So maybe Sani, you can try and provide a better answer on the expert review. So is this, so I'm a bit confused about the expert review. Is this different than the standard review process for common EPSRC grants, such as a standard grant?
So it is slightly different. We will, based on the applications we will receive, we will create a panel, or we will build a panel of experts who, out of that panel, several of those people will provide you with comments on your applications. Those will be the closest to your expertise, or to the expertise on the panel of the proposal, sorry. And you will then have the right to reply to those comments, but the same reviewers will read your project lead response and take that information to the panel, at which they will decide. So the reviewers behave as panelists as well. That's why it's called expert panel. In the standard grant, normally we would go to reviewers outside of the panel. So that's the difference. I hope I haven't rambled too much on that one.
That sounds clearer than my answer. So hopefully that's answered. But please feel free to get in touch with us by email, and we will answer the question fully as well on the FAQ document as well.
And just to make sure, just to assure people that the expert panel will be obviously built so it wouldn't be conflicted with any proposals which will submit it.
Yeah. Okay, there's a question. So my research team consists of 4 faculty members from engineering backgrounds working with an NHS research centre. Is this allowed to cost more than one researcher to have a short stay in the NHS? So yeah, that's fine, because these are team awards. You can have a few members of your team that that can go into the NHS environment. So yes, that is an eligible cost, and you can cost in members of your team to also have that stay in the NHS. Does the UK host institution get funding as well? So that is a question from.
So it depends on whether the host institution is eligible to receive EPSRC funding. I think we will share some links again for the eligibility of the organizations to receive EPSRC funding. Generally, if it's a university who is able to apply, or if it's NHS trust, it should be all right. The organizations who are not available to receive EPSRC funding are industry, and those would have to be listed as project partners, and they would have to commit to some in-kind contributions. So if you have a mentor or host in industry, they would unfortunately couldn't be covered by EPSRC funding, and they would have to give their time as in-kind contribution to the project.
So next question is, so engagement with clinicians to shape technological solutions to better address unmet clinical needs is a key aim of the call. So how formed should the solution be at this stage, considering a key aim is better understanding of unmet clinical needs? So is there any flexibility to adapt things as successful applicants understand the clinical need better? So yes, I would say the solution does not need to be formed at this stage. I think that's one of the purposes of the award, is to understand that unmet clinical need and understand that clinical environment. So we wouldn't expect you, I guess, thinking about the kind of research that you might that might take place as part of this award, it would be more like a pilot study where you could start to investigate those things, for example, with an unmet clinical need that you're working on. So that is exactly what we're looking for. We're not looking for people who have got fully formed solutions or research ideas.
Yeah, it is kind of an opportunity for you to get those preliminary data on some of your ideas or some of your thinking, and to see whether it is worth further exploring or not. And I think, yeah, it is kind of for you to address, but also I would we would expect that you will kind of outline how you would mitigate the issues if you already can predict where could be the roadblocks, how you would go around it, and how you would pivot if the roadblocks occurred.
Well, thanks, Susanna. So could we say a little more about the balance between skills development for the PI and the novel research components? Of course, we might expect those to overlap, but one could imagine scenarios where they may point in separate directions. So I would say the focus of these awards is around the skills development. But I guess we don't want to be prescriptive in how much time or the percentage of the project that you want to spend on research. But I would say that the aim of the funding opportunity is about that skills development piece. So the balance, I would say, of the award the focus should be on that. I don't know if you want to add if there's anything else to add.
Yeah, I'm not sure if I will be just paraphrasing what you've just said, but I think the overlap is obviously there. So if you will be going to your host and they will be helping you to learn new techniques, obviously the overlap will be bigger at the beginning, but then it is expected that you will develop some independency, and you will be able to use the techniques on your own, and perhaps work in the environment without as much of the engagement with the mentor, but also engaging with the other members of their group or of the department and so on. So that's probably it. I hope that it kind of answers the question.
Will the panel be made up of those with engineering and physical sciences expertise, or they also include clinicians? So I can answer this one. Mm-hmm. So it will be a mix. So we will include some clinical expertise as well. It will depend on the applications that we get in. Will depend on who we invite to be on the panel, but we would expect to have some clinical expertise as part of that panel. So yeah, we would expect that.
Plus, yeah, just to add, we would like to get experts on training on the panel as well. So to kind of get that expertise on career development and training in general as well.
So what share of overhead is assigned to the host? So you should cost this under the estates and indirect costs, and it's, I guess, however much it's kind of however much you need for the award. I don't think we kind of stipulate exactly what you can request, but it's kind of what you need for the the research project. But again, we can include a link to guidance around how to cost the sort of estates and indirect costs where that would be covered.
And just to add on to that, is the host obviously needs to be eligible to receive EPSRC funding. So, and then if they're named in the core team, then you can ask for the overhead for the host as well. And the last bit is that the cost justification is one of the assessment criteria. So that will go through the peer review process.
Okay. Can we choose more than one host organisation, one from the UK and one from outside the UK? The host institutions within the UK and outside can the host institutions within the UK and outside the UK get funding or not?
I can take this one. So multiple host organizations are allowed on the scheme. So you can definitely include host organizations both from UK and outside of the UK. However, host organizations eligible to receive EPSRC funding are only the UK based. So if or Norway based. Outside of UK or Norway, we will not be able to you will not be able to request cost for the host organization.
Okay, so we got a question around, can the new skills and knowledge acquired be less academically relevant but more industrially relevant? This may help with translation. Yes, you can. That's absolutely fine. You can have a focus on industrial collaborations as part of your award, and yes, that would help with translation. I guess the only thing to note is that the part of the application which is looking at research should be within EPSRC remit, so novel engineering physical sciences, that's pre-competitive.
And you should clearly address the health technology strategy in your proposal. Also, besides industry, we open to or we welcome applications with host organizations from public bodies and government and so on.
So the award will support, one, a person in an EPSRC field going to a non-EPSRC field, and two, a non-EPSRC field to EPSRC. Do we prioritise one option over the other? No, we don't prioritise either option over the other. I guess the thing we're looking for is, like Susanna said, that the research is addressing the healthcare technology strategy and meeting the other assessment criteria. So that's what we will use to, or that's what the panel will use to prioritise. But we won't prioritise based on where a person is based as part of their discipline. So can researcher co-leads be PDRAs?
I believe so. If the contract exceeds the duration of the award, they should be eligible to be named as co-leads. But for that, please go to the eligibility criteria and see who can be named as project lead or project co-lead. You can also name postdoctoral researchers as postdoctoral researcher assistants, but we definitely welcome if they become part of the leadership team.
Yeah, cool, thank you. Okay, when we say skills development, is it meant to be technical skills development, or could it also be softer, more translational skills, such as patient engagement, medical device regulation, human factors, and that things that expedite translation? Yes, that's we mean both. Yeah, we're trying to I guess open these awards to be as creative as possible, so wherever you think the skills needs are. So yes, we are open to people developing those more translational skills, and that those around things like, yeah, like you say, patient engagement, those are eligible as part of this funding opportunity.
Definitely involvement of social sciences or health economics would be very welcome as well.
Yeah. Just seeing if there's any more questions. Okay, can a project lead include percentage salary to cover teaching time? Do you know, I might need to check that question. I don't know the answer. Do you know the answer to that one, Susanna?
So, it depends how, if I understood it correctly, the question. So I believe that if you're spending time outside, obviously one of the assessment criteria is the host organization support. And we specifically mentioned that the home organization support, and that the home organization support should be within protecting your time to deliver against this award, which would probably mention, which would probably mean that they would have to find somebody else to do your teaching. So I think it kind of depends on the agreement between you and your home organization.
Yeah, if you've got more details, or you want to provide us with more information on that one, if you just drop Susanna and I a message, an email via the Healthcare Technologies inbox, we can look into it into more detail if that doesn't fully answer your specific case. But yeah, thank you. I think, oh yeah, there's another question come up now. So as we mentioned, this award is mainly targeted at preliminary data collection. Is in-depth analysis of data that is already collected acceptable? The skills to be acquired is more on how to translate the potential findings into practice. So I would say, yes, that's absolutely fine. If you've already got the data and you want to build that collaboration and perhaps do analysis or build on the data that you've already collected, that's absolutely fine. Again, I would just refer you to making sure that you're addressing the healthcare technology strategy and the EPSRC research remit. But yes, those that type of data analysis is completely within scope.
Yes, if the analysis takes you into different research environment and it's a different type of analysis than you would normally do, then it would be eligible.
So the page on the funding finder states we're particularly interested in projects which address our population health and prevention challenge. So is this a priority for this call, and would early detection or other challenges be equally considered? So the reason why we highlighted population health and prevention is we have a slightly smaller portfolio in that area, and we wanted to kind of, I guess, inspire people to apply within that area. But we are considering all challenges, and they will be equally considered. There isn't an assessment criteria which prioritizes population health and prevention. We just wanted to highlight it because we would like to see some applications within that area. And I think I'll just wait a second. Yeah, we got another question. We have filed some patents on some novel concepts of surgical robots. Can we use this call to validate these concepts in patents? So I would say if you've already sort of got the, you've sort of patented the technology and you've got the idea, this perhaps would be more a slightly higher technology readiness level, and so may not be within remit for this call, but please do reach out to us if you've got more detail, and we can have a look at the remit of your application. So again, if you send us an email via our healthcare inbox. We've also, if it's not relevant to our call, we can share it with other research councils and see if there's a relevant opportunity that you can apply to. So the host organisation has some equipment. Could similar equipment be charged to the costing so that this equipment can also be used at the home organisation?
So I can probably take this question. I assume it will all come down to your justification. If you can fully justify this cost and in the proposal, then it is permissible. Any equipment under £10,000 can go under the consumables. So this should be all right.
Great, thank you. So is Spring computer interface research fine for this call? Yeah, that's absolutely fine, and that's within EPSRC remit. You know, that's absolutely fine. You can apply with that particular area. Again, thinking about the vision for the call and what kind of skills and knowledge you'll acquire as part of that. Is it desirable or undesirable for the project leads who have previously had EPSRC funding maybe on the core technology?
Yeah. So I don't think we would prioritize based on that or made any decisions based on that. If you have already some grants previously, obviously the only thing is that you cannot cover the same thing or same project, so we wouldn't double fund you. So that needs to be substantially different to the already submitted grant or awarded grant.
Mm-hmm. Okay, I'll give it a couple of minutes, see if anyone's got any other questions. And of course, we'll circulate to everyone who's attended or signed up to the webinar, and also put on the funding page all of the questions and answers that we've discussed today.
Oh, we have one more question. It's using TOF cameras and AI identification for use in virtual wards within the scope of this call. I would say yes, if it's within, if it's addressing any of the challenges within health technologies strategy, then it is. If you have any more specific questions regarding remit, you can always email us at the healthcare inbox, and we will answer you case by case.
Yeah, and just a reminder, we'll provide a link as well, just that the research would need to be in EPSRC remit, so novel engineering physical sciences research. So how is this scheme different to an EPSRC fellowship? So I would say this scheme is more about somebody trying to find new collaborations, trying to develop new skills. It's almost like the start of a research project journey. So I guess what we would expect as an outcome of this award is that you would develop or strengthen a collaboration, learn new skills, and then you would be able to apply for a bigger grant afterwards. Whereas an EPSRC fellowship is more for somebody who's already got an established research idea, an established vision, and it's more about the individual that will be taking forward that research. Yeah, I don't know if there's anything you
No, I think I agree with your explanation.
Okay, give it a couple of minutes. Oh, we should also say as well, just to everyone listening, we are hoping that future calls may be issued in this area. depending on the outcome of this pilot scheme and sort of future budget. But we are hoping that we would be able to do another round of this scheme in the future as well.
And we are hoping to kind of collaborate with the successful applicants, but also to see in terms of unsuccessful applicants what proposals were submitted, so we could potentially adjust the scheme if necessary.
Okay, so we got another question. So does this mean the project does not necessarily need to lead to a novel outcome in terms of scientific, and technological discovery? So the research, I suppose that I guess I'm not 100% sure on the question. I guess because the research would need to be novel, just in terms of the assessment criteria as well. We are looking for sort of novel science to come out of this. So maybe if you could send an email just with a bit more specifics on that, that would be really useful. Somebody's asked if they can send a synopsis to us to check if it's in scope. Yeah, that's fine if you just send us an email if you're worried about the scope of your project. Then yes, you can do that. Okay. Okay, I think we're just winding down. Yeah, I just don't want to, just in case anyone's got another question come up. So is the skills development more important, more highly weighted in the assessment in this funding scheme than the research work itself?
So all the assessment criteria are equally weighted in this funding opportunity, and I hope that kind of answers the question.
Great, thank you so much, everyone, for joining the webinar. We'll just give it a couple more, 2 minutes till 11, and then we'll let everyone have the rest of their morning back.
But if you can think of any questions after we close the webinar, you're more than welcome to send the question into the healthcare inbox. And the webinar recording and also the frequently asked questions document will be uploaded soon-ish as on the website as well.
All right, we'll do 1 more minute. Okay, so somebody's asked, is there any split of funding constraint between home and host institution? We don't have any personal funding constraints. I guess it's just all about how you justify what costs you need on your project, and the negotiation you have between the two organisations about how they will support you appropriately and what resources you need in both to help you deliver your project. So we don't have any specific constraints, but there may be, I guess, your own institutional constraints about how that funding's managed. Okay. So I don't think we have any other unanswered questions. So yeah, I guess like Susanna said, if you do have any additional questions, please do reach out to us, send us an email to our healthcare inbox. Again, we'll circulate the slides, the email address is there. And yeah, thank you so much for your time today. We're looking forward to some really exciting applications into this call.
Thank you. I think I will close the webinar now.